The arrival of yet another Omicron variant has health officials on high alert. As we continue our look at what's become a pandemic roller coaster, Susan Spencer considers that other COVID crisis, our mental health.
This is Coco, and this is Juliet.
At home with her guinea pigs, Natasha Beltran seems like a happy 12-year-old. But since 2020, she has been struggling with grief beyond her years.
I remember my dad as a very funny guy that has a lot of friends near his neighborhood, and he likes to go movie theaters, hiking.
So you have a lot of good memories.
But on April 28, 2020, her father, Julian Pena, just 50 years old, died of COVID in a Bronx, New York hospital.
The nurse called me and she said that it was really bad.
Maxine Beltran, who is studying to be a nurse, is Natasha's mother.
They were running out of ventilators and they said, we have to remove him. And then they removed him. And that was it. I didn't know how to tell her, so I pretty much didn't tell her.
How did you tell her?
I had to tell her daycare lady to help me tell her.
Had you been able to go to the hospital and see him?
No.
So you never got to say goodbye?
And not being able to say goodbye haunts them both.
I thought it's my fault that my dad died.
You did?
Yeah, because I was like, if you would have talked to him or be there for him, he would probably be alive.
That's a terrible thing to try to live with.
I know.
It wasn't your fault.
It wasn't, baby.
When a 10-year-old loses her father and can't even go to the hospital to say goodbye, how do you undo that?
Well, it's not a matter of undoing. It's how do we help children cope with those situations? We just looked at what was going on.
Psychologist Arthur C. Evans Jr., who heads up the American Psychological Association, says unresolved grief is just one piece of the pandemic's widespread mental health fallout.
We're seeing the number of children going to emergency departments in psychiatric distress going up. We see a number of people who are dying because of overdose, over 100,000 people last year. We're seeing the number of people who are experiencing anxiety and depression at 4 times the rate.
4 times?
It's 4 times what it was before the pandemic.
In a country divided on everything, roughly 9 out of 10 Americans agree the U.S. is in the grips of a full-blown mental health crisis. And even now, with masks coming off.
Would you expect the mental health situation to also get a little bit better as the virus recedes?
No, it's going to be with us because what we know from research is that when people experience these kinds of traumas, people after 9/11 or Hurricane Katrina, that we expect to see people experiencing problems for at least another 7 to 10 years out.
So you're basically talking about a second pandemic.
We are, because if you look at the numbers of people that are affected, it's clearly at the scale of a pandemic.
Oh, that's cute.
Yeah.
One horrific number tells Natasha Beltran's story. More than 140,000 children have lost a parent or a caregiver to COVID. And getting help for these kids can be almost impossible.
To find a children's therapist that is covered under your insurance, it was mayhem.
You couldn't find anybody?
I couldn't find anybody, and I'm a single mom. I don't have her dad. I don't have any help or somebody that can chip in or contribute.
In most parts of the country, kids are seeing significant delays in getting the help that they need, not just weeks, but often months. And that would be unacceptable if our kids had cancer, for example, and we were told that they can't see a physician for 4 months.
California may be about to change that.
Every school I visit, I hear the same thing. We need more resources. We need more counselors.
California Superintendent of Public Instruction Tony Thurman oversees the system with more than 6.3 million students.
I'm certain that you know the challenges that our students and our families are experiencing.
He's pushing an ambitious bill before the legislature.
We've set a goal to build a pipeline of an additional 10,000 mental health clinicians over the next several years.
10,000 in the California school system.
10,000 in California.
I saw you quoted somewhere as saying this is the way where we can leave an important mark. What did you mean by that?
Job number one has got to be attending to our social emotional learning needs of our kids. And so I think that's the legacy that we have to leave.
In New York, the Beltrans went months without proper help until they found a nonprofit called the Children's Village. Daphne Torres Douglas is its vice president of behavioral health services.
We're always hearing all the time, oh, kids are so resilient.
Resilience doesn't take away the trauma. We still have to address the fact that they're hurting.
Which is why the Children's Village provides counseling free of charge.
We see a lot of young people suffering from losing family members, and we see young people not having the ability to cope, and we see the adults not knowing how to help them. Oh yeah, we got one.
Oh, we got one.
The social worker assigned to the Beltrans worked with them in their home.
What was it about the social worker that reached you?
Ah, so many things. It's just her energy, so positive, so calming. Like, I understand what you have gone through, and I am here to help.
You felt like you could talk to her.
Yeah.
What's your assessment of how the Beltrans are doing?
They're doing really well, but this may be a long process for them, and that's okay. And as long as they have one another and they are connected to one another and supporting one another, they're going to be okay.
A hopeful outlook that 2 years later, Natasha Beltran is ready to embrace.
Natasha, a lot of kids have lost parents or caregivers. What would you tell them?
It's not your fault.
You won't ever stop missing him,
No.
but that's okay.
I know.